Some rashes look harmless, others seem purely cosmetic, but a few of them are your body quietly warning you about an autoimmune disease, vascular damage, a hormone disorder, or even cancer. Today, I'll show you how doctors read the skin and how paying attention to these rashes can save lives. Let's start with one of the most famous signs in medicine. This classic butterfly-shaped rash across the cheeks and nose is one of the most recognizable signs of lupus. Lupus is a systemic autoimmune disease that can affect your joints, kidneys, lungs, and even your brain. Now, compare that to rosacea. Rosacea also causes facial redness, but it often comes with visible blood vessels and acne-like bumps. It typically gets worse with spicy food, alcohol, or sunlight. They can look very similar. So how does a doctor tell them apart? Here is a clinical pearl. Lupus almost always spares the nasolabial folds, those creases that run from the sides of your nose to the corners of your mouth. If the redness goes right into those creases, it's much less likely to be lupus. Now for a simple, life-saving trick doctors use called the blanching test. We press on a rash to see if it turns white. If it blanches or turns white, it means the blood is still inside the blood vessels. But if it doesn't blanch, that means blood has leaked out of the vessels. This is a sign of vascular damage. This simple test is often how vasculitis is first detected, a condition that can destroy your kidneys, lungs, and nerves if it's missed. I'll never forget a patient I saw in the ER. He had a tiny, non-blanching rash on his foot. Just a few little purple dots. That small clue led us to a diagnosis of a serious type of vasculitis called granulomatosis. With polyangiitis, we started treatment immediately, likely saving his organs and his life, all because of a small spot on his skin. Next up, eczema versus psoriasis. They both cause red, itchy patches, but they appear in different places and signal very different risks. Eczema loves flexural areas, the inside of your elbows, your wrists, and behind your knees. It's known for its intense, unbearable itch. Psoriasis, on the other hand, prefers extensor surfaces, the outside of your elbows and the front of your knees. It creates thick, silvery scales on top of the red patches. Why does this distinction matter so much? Because they're associated with different internal problems. Eczema is linked to asthma and allergies. Psoriasis is linked to a much higher risk of heart disease and a type of inflammatory arthritis. That's because psoriasis isn't just a skin issue. It causes systemic vascular inflammation throughout the body. What if you suddenly notice soft, fine, white hair growing on your face or body? This isn't just a cosmetic issue. It's a condition called acquired hypertrichosis, lanuginosa, and it's a major red flag. This sudden hair growth is often linked to an internal malignancy. In one case, one read about a patient developed this fine hair, which prompted a full workup. Doctors discovered an early-stage colon cancer. Because the skin spoke first, he was able to have surgery and was completely cured. His skin literally saved his life. Have you ever seen dark, thick, velvety skin in the folds of someone's neck, armpits, or groin? This is called acanthosis nigricans. It's not just dirty skin. The underlying cause is usually high insulin levels, which stimulate skin cells to grow rapidly. This is a classic sign of insulin resistance, the precursor to type 2 diabetes. The good news? This is one skin sign you can often reverse. With changes in diet, regular exercise, and weight loss, the dark patches can fade and sometimes disappear completely as your insulin sensitivity improves. Acne is common in teenagers, but what if you're an adult and suddenly develop severe acne? This can be a sign of a hormonal imbalance. It could point to polycystic ovary syndrome or PCOS. It could also be a sign of something more serious, like Cushing's syndrome, which is caused by excess cortisol, or another condition causing androgen excess. I remember a patient whose Cushing's diagnosis was delayed for years. She had massive weight gain, severe acne, and deep purple stretch marks across her abdomen. Once she was finally diagnosed and treated, her life completely turned around. That's why new, severe acne in an adult should always be investigated. Now let's talk about a strange, net-like purple pattern on the skin. This is called levator reticularis. In a cold infant, this marbled skin pattern is usually normal and harmless. But in an adult, it can be dangerous. It can be a sign of vasculitis or a condition called antiphospholipid syndrome, which dramatically increases your risk of blood clots. If you see this pattern on your skin, especially if it doesn't go away when you warm up, you should never ignore it. There's a specific combination of symptoms that's an emergency: a rash plus muscle weakness. This duo points toward dermatomyositis, another autoimmune condition. The classic signs are a purple rash on the eyelids, a rash across the upper back and shoulders called the Shaw sign, and reddish bumps on the knuckles, known as Gottron's papules. What makes this so urgent is its strong association with cancer in adults. I've had 2 patients whose cancers were caught early because of these skin findings. One had lung cancer, the other had stomach cancer. In both cases, the rash appeared first, leading to the life-saving diagnosis. We all know what hives look like. They're typically itchy, they move around, and they're usually gone within 24 hours. But what if your hives are different? What if they're painful instead of just itchy? Or if they leave bruises behind when they fade? Or if you press on them and they don't blanch? These are not normal hives. These are dangerous hives, and they should make you think of urticarial vasculitis, inflammation of the small blood vessels. It's a much more serious condition that requires a doctor's attention. Finally, a very rare but very deadly sign called tripe palms. This is when the skin on your palms and sometimes the soles of your feet becomes thick, velvety, and develops an exaggerated, ridged appearance like boiled tripe. It's an unmistakable sign. An astonishing 90% of cases are linked to an underlying cancer, most commonly lung or stomach cancer. Your skin is not just cosmetic, it's diagnostic. It's constantly communicating with you. If you notice something new or different, don't ignore it. It could be the first and most important clue to what's happening inside your body. And if you want to learn how doctors use the tongue to detect disease, make sure you watch the next video. Thanks for watching.